Yeah, and also sorry if my energy is not as high as it usually is. I feel like really sick today for some reason.
No,
I
it's
don't
all
know what
good.
happened,
It's
but
all
yeah,
it's all
I
good.
felt terrible. I felt terrible pretty much all day. I had to like leave clinic early because I wasn't feeling well.
It's all good. Okay, let us begin. Hi everyone. We are here today with Isaiah Sampson. He's a dental student studying at UCLA, and we'll be discussing his journey so far in the dental field. Isaiah, whenever you want to start, whenever you're ready, you may start.
Sounds good. So, like you said, just gonna talk a little bit about dentistry, what it is, what it has to entail, dental school itself, and then some of those few pointers that it would take to be able to get into dental school. So, and this is Tyler, the creator, and he has awesome dental jewelry, which I think is really cool. Okay. So, about me, like you said, my name is Isaiah. I'm a second year student at UCLA. For undergrad, I went to Arizona State University and I studied microbiology with minor in music. Got a bunch of siblings. I've lived in a bunch of places, and this is one of my favorite things to do, doing things related to mentoring people who are trying to get into dentistry. And I also love doing social media stuff. Fun fact, my birthday is tomorrow, which is really fun. Turning going to my Kobe year, and I've wanted to do dentistry for a pretty long time, since about 11th, like 10th, 11th grade. 11th grade is when I started seriously considering it, and one of my major goals is to be an orthodontist. So, what is dental school? So, for the most part, dental schools are 4 years. There is one 3 year program called the University of Pacific, and it is a lot more fast paced. So, generally speaking, most dental schools are 4 years. The first 2 years, you're taking a lot of your didactic classes with a few preclinical labs. The didactic classes, I'll go into those, what they specifically are later. And then the preclinical labs are you practicing the basic procedures for dentistry. So you're going to be doing your crowns and your fillings. You're going to be learning how to take impressions and doing all of those things that are kind of the lab work and behind the scenes aspects of dentistry as well. And then the last 2 years, are going to be the clinical years where you're going to be treating patients, you're going to be going on those rotations, getting used to that life as a dentist, and building up your clinical skills in addition. And then after graduation, you have the opportunity to either just go straight into private practice, which is a really cool aspect of dentistry. You can do your 4 years of dentistry and then go into real life, or you can go into a residency in order to be a general dentist to give you more experience in an educational setting, or you can do residency in order to specialize. So if you find one particular field of dentistry very cool to you, you can choose to just do that and specialize in that. So just to expand further on those first 2 years, those classes that you're going to be taking, like your anatomy, your dental materials, your biochem, micro, those kind of classes like that, as well as the classes that you're going to be taking, the labs that you're going to be taking in order to like learn how to do crowns and fillings, root canals, things like that. I guess that would be the second year of the root canals. The classes in the second year, you start to get more concentrated and a lot more specific and intense with those different classes, and then how those classes relate to dentistry, which is really cool to be able to have that very like physiologically focused first year, and then have those different physiological concepts relate to how dental school is going to be working, or how dentistry works. And the last half, like I was saying earlier, you're going to be doing your treating of your patients, going on your rotations. And this is when you're really building your skill set, not only clinically, but also as like a communicator and everything like that as it relates to dentistry. And then like with the new boards, we're taking our boards at the end of our third year. And then we're going to be doing our licensing exams and stuff during our fourth year if you're not doing a residency. So what are the different specialties, or what are specialties in general? Like I was saying earlier, it's something, if you find one particular aspect of dentistry really intriguing, and it's something that you'd really like to focus on and master rather than being a general dentist and doing a bunch of things, you can choose to specialize and just do procedures related to this certain aspect of dentistry. And it allows you to see some of the most complex cases. It allows you to see some of the coolest cases. It gives you a lot more opportunity in academia. And also there are some financial implications, not always, but there are sometimes financial implications to being able to specialize in the field. The different specialties, these are the few accredited specialties. There are a few more than this. They include oral and maxillofacial surgery, which is often referred to as OMFS. You're doing like your root canal, not your root canals, your wisdom teeth extractions. They do things from wisdom teeth all the way to like jaw surgery. They can do bone grafts. They can do a whole bunch of different surgical things. Orthodontics, so this is doing your braces and your teeth aligning and your growth modification and different things related to the bone and the oral structures of the structures of the face. Pediatrics was treating children. Endodontics is the root canal specialist, so they're doing those kind of procedures. Periodontics are specialists of the gum tissue and the under supporting bone, pretty much all of the structures that support the teeth. Prosthodontics, these are prosthodontics and oral and maxillofacial radiology should be different bullet points, my bad. Prosthodontics is pretty much general dentistry, but to a way more expansive and difficult, a bit more expensive and elevated difficulty. They're going to be doing a lot of like the full mouth restoration cases. They can do a huge amount of very intense reconstructive cases for the mouth. And yeah, they can do a lot of really cool stuff. And there's even parts of prosthodontics where you can do oral and maxillofacial prosthodontics where if someone had like an accident or they had a cancer where they needed a bone resected or a part of their face resected, you can restore that, like literally a part of their face. And it's very artistic and it's really cool. Oral and maxillofacial radiology, which is you're dealing with the like radiographic aspects of dentistry. So your CBCTs, your MRIs, your X-rays, and how those are going to contribute to diagnoses. Oral and maxillofacial pathology, which is if someone has some sort of lesion, the most likely going to be an oral surgeon. They can extract that lesion, send it off to the lab, and the pathologist will be able to see not only with microscopic specimens, but also growth specimens to be able to see what one of those pathologies are. And this is really cool and different from pathology of medicine. Because the tissues in the mouth and things related to the oral cavity are very specific. And so this is a really important aspect of diagnosis and treatment. Oral and facial pain, what's most commonly seen for them is being able to see people who have like TMJ pain and different things that are related to oral pain or chronic oral pain. Oral medicine, which is if you have a patient who has a really complex medical history and they still need dental treatment, they're there to help guide that treatment and with being able to consider all of the ramifications of their complex medical status. Dental anesthesia, whether it's someone who has high dental anxiety, children, people with special needs, they're able to help them get treatment in the least traumatic way possible. So they're doing the anesthesia for those cases, which I think is a really cool specialty. And then dental public health, which is being able to navigate and educate on the different public health aspects of dentistry and things of that nature. And so how to get in, you have to go to a four-year or graduate from a four-year university or get a four-year degree from a four-year university. And then while you're doing that, you can be any major you want, but you do have to do certain prerequisites. And so it would take, you have to take your biology, your chemistry, your physics, your biochem, English, calc, stat. And there's a whole bunch of different, some classes or some schools require microbiology, some don't. And there's a whole bunch of different classes that different schools are going to require. That really just takes a bunch of research into what schools you want to apply to and what prerequisites they have for each of those classes. So if you've done all your prerequisites or you're doing your prerequisites, you're in college, what's going to make you a competitive applicant? And it's a combination of these things. So a higher GPA, which is generally you would want to be applying with over 3.5. A high DAT score. This is a little bit more relative to the school. Schools have a whole bunch of different DAT ranges. You can get anywhere from something that's probably more comfortable to apply is like a 19 or higher. Extracurricular activities can look like leadership positions in club organizations, volunteering, whether that be dental related or non-dental related. I didn't do any dental related volunteering. Or community service. Dental shadowing, to be able to shadow a general dentist and be able to show that you are genuinely interested in the field of dentistry. You put your time in to make sure that it's something for you, and you've been able to see how dentistry works, what dentistry entails, and all of those aspects of dentistry, and then a good personal statement to describe why you want to be a dentist and what do you think that you've done that will make you a good healthcare practitioner. And then letters of recommendation. You could have 3 letters or 3 or 4 letters of rec, or you could have a committee letter, which is something through your school. So what did I do? So this is me as a baby in undergrad. These are actually my graduation pictures. A few of the things that I did in college, like orientation leader, different mentoring opportunities. The larger things I did was the teaching assistant for general biology for majority. It was like 2.5 years or something like that. Yeah, or it might have been 3 years. Something. I think it might have been 3 years. I was a teaching assistant, or probably 2.5. Tutor for immunology, virology, doing research, volunteering, doing leadership for clubs and for the school and college I was in, and then a lot of dental shadowing. And this is mostly general dentist shadowing is what I did, which you can do specialty shadowing, but mostly you'd want to do a majority of your shadowing at a general dentist. So when you're applying, it's this common application called Dia ADSAS, and you would fill out all of your information. So with your general demographic information, your personal information, you would submit your transcripts, your DAT score, and all of that stuff to Dia ADSAS, along with your extracurricular activities and everything you've done. And then the schools will have attached that you're applying to, they'll have their secondary applications attached. So you would, in addition to the common application, you'd fill out the additional secondary application, with the specific questions that the schools have. So this is the thing that everybody's nervous about but excited for after application. After you've submitted, they usually, you can submit your application in like June, the beginning of June. I think it was June 5th when I was applying. You can start your application on like early May, mid-May, and then you can submit your application in early June. And once you submit it, all of like June and July, and most of August, they're doing the schools are going to be doing application reviews, and then starting in like mid to late August, you'll start getting those interview invites. And this is pretty much just going to the school. Obviously, they're going to interview you to see if you'd be a good candidate and a good fit in their class, but it's also an opportunity for you to get to know what the school has to offer for you. And that's one of the large parts that people often miss out, is they're so nervous about making sure that the school likes them, is that they don't often try to think of if they like the school at all. And so that's one of the more important aspects of an interview. And these run August till I think it's about April or so. But what's weird about dentistry is the first round of applications, they're going to be released on December 1st, or it depends on if it's a weekday or not. My year was December 3rd, but it's usually December 1st if December 1st is on a weekday. And all of the schools around the country are able to officially send out the offers they have. And then with the remaining spots that they have, they are still interviewing, and they're still giving spots to students all the way up until sometimes May. So in summation, dentistry is a really broad field with plenty of opportunity, whether it's in academia, private practice, corporate dentistry, legislation, anything like that. Getting in is a challenging and arduous process, but it is also a cool process to be able to develop yourself as a professional. So people often just see the monotony of trying to do a bunch of different things that they're interested in, but it's often overlooked that you're doing things that are developing yourself as a professional. And that's what the purpose is for you having all these things to try to highlight on your application. And the interviews can be very stressful, but it's always fun. I still talk to people I met on my interviews who I don't go to school with. You can meet a whole bunch of different people, get different experiences in places you haven't been. Like I went to New York for the first time for an interview, which is really cool. And then you can decide what school that you want to go to. And that's often something that you will be able to do, is going to a school and then seeing that if you actually want to go there or not. There were some schools that I went and interviewed at, and I was like, I really would rather not go here. But that's just a part of the interviewing process, seeing if you actually would want to go to that school. And yeah, dentistry is a dope field. And so that's the end of the formal presentation. I guess we're going to be answering some questions now.
Thank you so much for presenting with us today. So our
Of
first
course.
question is, what made you want to pursue a career in dentistry?
Yeah, so there's two more like kind of distinct moments in my life that kind of led me to dentistry. The first being when I was younger. I was around 10 and my little sister was 6. After one of her basketball games, she had a teammate and he was so bad. He was always trying to mess with everybody, specifically me for some reason. He always decided to mess with me. Maybe I seemed vulnerable to him, even though I was older. But he was trying to mess with us, and I was on the older team. They were on the younger team. He was always trying to steal the ball from me, and this time he tried to steal the ball, and I moved it away from him. And then he ended up tripping, falling, and his head hit my little sister in the mouth, knocked out all of her anterior teeth. And so she was sick. She wasn't supposed to lose those teeth yet. And so that was large dental trauma to the mouth. And since the baby teeth serve as a template for the incoming permanent dentition, as well as a whole bunch of other things, her permanent teeth came in all kinds of weird. And so the orthodontic treatment that she had to have over the year was extensive, and it was very interesting to me. And then as I got older, like the later years of high school and then my early years of college, my mom developed some dental health issues. And then seeing those ramifications of her dental health issues really submitted like a visceral importance of dentistry and how personal it is to so many people. And those experiences, along with the fact that I love science, I love microbiology, cell molecular biology, um, it just kind of came together as something I wanted to end up pursuing.
That's amazing. What made you want to choose orthodontics as your specialty?
Yeah, so ortho is really cool. And one of the things that I like about orthodontics is different people come to you with different like philosophies behind their smile and different life journeys behind their smile. So you get like little kids who think a pretty smile is pretty, and that's pretty much the extent to it, is those psychosocial developmental aspects of a smile. And then you have some people who are a lot older who come to orthodontics, and they're a lot older. They've had years behind the smile that they have, and they're coming like because whether they just were able to get the money to get orthodontics or whatever it may be, they're coming with a whole lifetime experience behind what their smile was, and they think that that's something that's still really important for them to want to change about themselves. And that's like a really cool experience to see people go through. Like my sibling, my uncle, like seeing people who are older in their experience being able to come and be like, this is something that's important to me, and this is something I wasn't able to do that I really want to do now, to make me feel better about myself. And it's really cool to see that spectrum between people who want to do things for their smile, as well as there's a whole bunch of really cool stuff with orthodontics with like growth modification. So whether someone has different types of orientations of their facial structure, being when they're a young age, you're able to do certain treatments in order to like guide growth in different directions in order to give them a more optimum outcome of their treatment, which is really cool to me.
What made you pick UCLA for your dental school?
Yeah, so I kind of knew I would end up going to UCLA if I got in, regardless of any permutation of what I was getting into. Even before I was applying to dental school, just because for one, it's in-state for me, which means it's significantly less money. It is a pass-fail dental school, which you don't have grades, GPA, class rank, which removes a whole bunch of stress from dental school. Whereas in undergrad, you're trying to get 100 on every exam in order to get a perfect and shining GPA. All you have to worry about now is making sure you know the material, and then getting the grades is secondary. Um, they have a very high interest on research, and they get a lot of funding from research from NIH, which is a really good indication of how much your school is contributing to the field of dentistry. The people I met on my interview day, like Dr. Hewlett, he's an amazing person, and he made me feel like I would be really comfortable coming here and the environment that I'd be in. Um, and yeah, it was in state, and it's close to my family and things like that. So it seemed like a good fit, and it seemed to have. Oh, and sorry, they have a really high specialty rate, a specialty match rate. So like about 70% of the people here go on to a specialty or postgraduate residency. So that's something that I was looking for in a school as well.
Another question is, where do you see yourself past dental school?
Past dental school, after I'm completed with everything, I'd want to, I guess, for the first few years, everybody would be working as an associate at a practice, but I want to eventually have multiple practices, like 2 or 3 practices that operate in different locations, in addition to be able to have dentistry contribute to the more like business aspects of like humanitarian things I want to do in order to help housing for different populated groups of people. So be able to own property and own business complexes that contribute to how certain communities interact with that aspect of the world would be something that's really cool to me, along with the dentistry, of course.
What advice do you give pre-dental students?
It would really depend on what stage they're in. But one thing I could say for everybody is when you're picking the things that you want to be involved in and in college and an undergrad, make sure for one, they're things you like, but be very meticulous about what skills you're trying to build that contribute to you being a good healthcare professional. And I tell this to everybody is when you're doing random things that you think will look good on your application, when it comes to write them down and what that experience help practice for you, it can seem really random if it's just a whole bunch of stuff you thought would look good. And so when it comes time to digest your application and see what skills you build it and how that's going to contribute to you being a good healthcare provider, it can often seem disorganized. So if you have a few things that you think that you want to develop personally, a few skills that you think would contribute to you being a good healthcare professional, make sure you're doing experiences that are going to contribute to seasoning those skills over the years. And so when it comes time to complete and submit your application, you have these things and these experiences that you're passionate about, but also they've been developing certain skills that are going to translate to being a good healthcare professional. And that's going to be easily digestible to the admissions committee. And I think that's something that's really important to do.
The next question kind of ties into the question before. What extracurriculars should pre-dental students take part in?
It's really anything, and I know people hate to hear this, but it's really anything that you like and that you think would help develop you as a person. Like for me, I love doing things that involved communication, mentoring, teaching. And so a majority of my things were like communication with the orientation, mentoring was the mentoring things that I did, teaching, which was being a TA, being a tutor, um, yeah, being a TA, being a tutor, teaching a course, and stuff like that. And then also wanted to develop some leadership, so I was able to do some stuff like being a representative for my school and my college and things like that, as well as the ambassador organization for my school. So it depends on what you want to develop yourself in, and also what you enjoy. So those are some examples that I pursued for certain reasons, and people can do with it what they want.
How do you deal with stress?
um, Being an undergrad, it would be a lot easier to answer. In dental school, it's a lot harder to answer that question because I guess I really didn't know what stress meant until now. But one of the things is really have things that you know for sure will help you detach yourself from whatever the stressor is. Um, so I like playing music, I like playing video games, I like doing things like that. So when it's time for me to stop being school Isaiah and then start being Isaiah, these are the things that I'm going to be able to do in order to make me feel more like a human and a student. And those moments, even though they get more few and far in between as you progress in your education, they're really important to maintain throughout that time. And when it comes time, when it comes time to being able to manage what is going to be contributing to stress, being very organized is also something that I've often used to take for granted in undergrad, even though I was pretty organized. But when it comes to dental school, you have to be very organized in order to maximize your efficiency and minimize your stress. So being very organized and knowing things that you can do to detach yourself from your stressors.
This might be our last question. How did you prepare for the DAT?
So I prepared by doing Dat Destroyer. It's this book, and they have a whole bunch of practice problems for your biology, your chemistry, your quantitative reasoning. And so I was just doing a bunch of practice questions on that book. And then in addition, I used DAT Bootcamp, which is also practice problems, but they have like different videos and things like that. I wish I would have watched the videos more rather than just doing practice problems and practice tests. But those are two resources that you can use. You could either do the route of just doing a bunch of practice questions and then putting together the pieces of where you need to improve there, or you can start from scratch and watch those lectures and watch those videos on the material that you're going to be seeing, and then guide yourself into doing those practice problems and practice tests. And it's going to look a lot different for everybody. I took the DAT and I didn't think this would be one of the hardest, it would be one of the hardest semesters of undergrad, but it ended up being, I was like it was taking physics 2, biochem, microbiome, along with like the elective courses. And so it's kind of hard to navigate depending on the situation you're in. But yeah, those two sources are something that I find are very consistent amongst a lot of dental students. And they end up doing pretty well based off of it. So it's doing those practice problems, going over those lectures, and they're pretty much structured for you for the most part. So it just comes down to putting in the work.
That's amazing. Thank you so much for presenting with us today. I think that's all for our questions.